Hello, everybody. So just to give you a bit of a background on how I got into this whole area of exercise and health psychology in the oncology context is I had the opportunity of, when I was doing my PhD, of working with some of the dragon boat teams that were happening in the original movements around dragon boating for breast cancer survivors. And while Dr. Dawn McKenzie, who's one of Dr. Cornea's collaborators from the physiology side, was focused on sort of dispelling the myths that exercise is feasible and effective during treatment and post-treatment for breast cancer, I kept thinking, well, how does it work? 22 women in a boat, that's crazy. So really trying to focus on not only trying to understand what it was about dragon boating that drew the women into the activity, but then also knowing that, being in Vancouver, there was a lot of water. However, if we move inland in Canada, there's a lot less opportunities for dragon boating. So what did the women get from dragon boating that we could then tailor to other programs for women who, one, don't want to be in a boat with 22 other women, or two, don't have water to be in these boats. So that was really the challenge for me, was to try to understand, and as you've heard today, trying to understand how to get activity at an enjoyable level for more people, and really that's where my focus has been on. So most of my research is focused on the mental health benefits of exercise and looking at what level of exercise is attributable to those benefits. Now, we've heard a lot of evidence on the moderate to vigorous level exercise and the benefits, and one of the advantages, I guess, from my area is that from a mental health perspective, the low levels of activity are quite beneficial. So things like depressive symptoms, anxiety, mood. How many of you have felt crappy in the last week, 2 weeks, 3 weeks? So, if you think about how can we help just the day-to-day people feeling better? When we feel better, we enjoy things more, we're more likely to do them. So so most of my research focuses on the mental health benefits, and in terms of reducing depressive symptoms, helping with anxiety symptoms, improving positive mood, and reducing negative mood as well. And so, taking on that context of dragon boating, is really, the bottom line is we have to do things that we enjoy. And one of the questions that I get asked the most when I'm doing interviews and talks, and when I work with patients and survivors, I get the question all the time, well, what is the best activity? So you're telling me to exercise, what should I be doing? Does anybody know the answer? Anything. The thing that you enjoy. So if I was to stand up here today and tell you that running is the best activity, but you hate running, you're not going to go tomorrow and start running. So the best activity is the one that you will enjoy. Now, take that into a little bit further. When you find the activity that you enjoy and you consciously make a choice to change your behavior, you feel like you're accomplishing something. Small steps, you can do it, you feel like you're accomplishing, you're more likely to do it longer. Taking from, some of the work that we do in a behavioral counseling perspective is, you want to find something that you can do, you do it, you focus on what you're doing, and then over time, you add a little bit more to it. So we're asking everybody to start small, recognize that you're accomplishing something, gain the confidence to be able to add a little bit more to get to those levels that Dr. Cornea and Daniel were talking about in terms of the actual physical benefits associated with higher level intensity exercise. When we work with individuals, in particular women, really don't like high intensity exercise, don't like strength training very much either. So it's about finding those smaller activities that we can build on to get you to the point where we agree that exercise is fun and enjoyable. We saw it here. So it's just finding those activities for you. And from my perspective is gaining the confidence and the self-efficacy that it requires to then continue with exercise and adhere to those programs long after treatment has ended or long into survivorship period. So just a couple of things from our perspective. We tend to focus on sort of the behavioral counseling aspects. So how do we get people to exercise? And we focus on things like goal setting, which is, I'm sure you've heard, it is extremely beneficial to starting a program. Setting goals that you can accomplish is extremely important. We also focus a lot on regulating one's emotions. So just the idea of making sure that most people focus on exercise before they go out the door. Oh, I really don't want to go. However, if you actually focus on after you actually get out the door, how good you feel, and once you come back from exercising, that you actually accomplished it, you feel great. So we try to get people to focus on those emotions and how they feel after rather than before, because the before part, very few people actually truly enjoy it for a long time, I will say. The other thing is social support. So we tend to, we like to put an emphasis on trying to get someone else to be active with you if that's what you want. Dr. Jones and I have a intervention study going on right now where we're actually providing an opportunity, and I call it, for those of you in the room who are familiar with Lava Life or any of those online dating forums, we're doing this but in an exercise context. So what we're doing is offering a program for people to sign up and to find an exercise partner. So nothing to do with dating or romance, but if you want someone to show up at your door and take you out the door to exercise, you can find that person. If you just need the person to call you on the phone and say, tell me that I'm doing a good job, then you can find that person. So we're trying to help more women. Right now it's focused on women, but over time we'll add men as well who have had cancer, who just need that extra little bit of support. So easy, small things that we can do using technology at our advantage. We hope to have people across Canada sign up and find people in their neighborhood, in their environment, or again, someone that can just call them up on the phone and say, get out the door. So that's one sort of initiative, and that just brings me to the other, we had these questions that were brought around to us to answer, and one of them was about technology and how can technology help people. And here at ELLICSR, there's quite a few initiatives going on. One that Jennifer is starting in terms of iMove with health coaches, online coaching platforms that people can use. There's also many gadgets, so you can get caught up in the gadgets, but I forgot to put mine on this morning, but there's, you know, the bracelets that you can wear that tell you how many steps you're doing. There's little Fitbits that you can either put on around your wrist, around your neck, in your shoe to tell you how you're doing. And I would say part of beginning to exercise is knowing what you're doing. And some of these gadgets are extremely beneficial to give you feedback to say, oh, I really actually took a few extra steps today. What did I do differently? Okay, I'm going to try to do that tomorrow as well. And so using technology that's available now can give you the feedback that you need to keep going. And I think the things that we have available are extremely beneficial. Research doesn't keep up with technology. The technology is constantly going and going. So we're trying to come in and say, how can we use what's already out there to help more people become active, because we can't sit down with every single person every single day and help them exercise. So there's a lot of great tools out there that we're happy to help anybody with along the way. And also those tools are great for barriers as well. So there's a lot of exercise barriers. We know people sort of have everything under the sun, that all the reasons why they don't exercise, much less why they exercise. And so some of these technology tools can help identify what those barriers are and how to overcome them. So I encourage you to check out anything from just online forums to the actual wearing of some of these technologies to see what works well for you. And if you're the type of person that just likes to write everything down and use the typical piece of paper and pen, then I also encourage you to do that, because writing down what you're doing and making a conscious effort to make those changes is highly, highly beneficial for both your confidence, your feedback, and to keep you exercising. So I'll end it there. Thank you.